Okay, now we learn about Icsi lab. What is Icsi? What is Icsi? Intracytoplasmic sperm injection. So inside the cytoplasm of the ovum, we'll inject the sperm. That is known as Icsi. Okay. So this Icsi is done with the help of Icsi manipulator. Okay. Indications for Icsi are ejaculated sperm. Okay. Then ejaculated sperm if shows oligospermia, asthenospermia, teratospermia, globospermia, matlab means everything is there. Fertilization failure after embryo transfer. Okay, normal embryo transfer which was done. Okay, for that we'll do Icsi. That is better. Epididymal sperm is collected for congenital absence of vas deferens. Okay, other indications are failed vasoepididostomy, failed vasectomy, okay, obstruction of both ejaculatory ducts. Hmm? Then testicular sperms are taken. All indications for epididymal sperms and also for agiospermia. Okay, so epididymal sperms is done in case of congenital absence of vas difference. Also, this failed, and also testicular sperms are collected from the same indications and agiospermia. Okay, if you see the images, see this is this total this it is two instruments. This instrument is two instruments. Okay, one is one is micro manipulator, other is microscope. This is known as inverted microscope. This is known as inverted microscope, right? Whereas this is a manipulator. Okay, and if you properly see this image, you can see two needles. Okay, if you properly see this image, you can see two needles. Where are the two needles? These two. Okay, this is one needle and this is one needle, right? So by using these two needles, we'll select the sperms, and we'll select the sperm, and one needle will fix the ovum like this, another needle pushes the sperm into the cytoplasm. Okay, that is the process of these two needles. Okay, that is about that. These two needles are in they're given this image, that is micro injector. This one is micro injector. Okay, so this is inverted microscope with manipulator. So micro manipulator system consists of three parts. I already told one is, I told two parts, that is inverted microscope, micro manipulator, and micro injection micro tool. Okay, micro manipulator, micro injection micro tool, that needles. Okay, there are three parts. So inverted microscope are used for Icsi. Inverted microscope have actually sees the eggs and embryos very closely. Okay, the microscope stage where the dish is placed heated at 37 degrees. So inverted microscope consists of heating stage also, so that it maintains the optimum temperature, and it has good optics, high resolution optics, and it has a differential interference contrast. Hoffman modulation contrasts are available. The magnification is such high that it is 200 times or 200x magnification, and there is anti-vibration table. Okay, that microscope where Icsi is performed is anti-vibration table or platform. Coming to manipulator, two identical manipulators are mounted on either side, which I already showed you. Okay, on the microscope, both these manipulators are capable of XYZ axis movement. All that movement are present. See, Z movement means if you wrote like this, X movement means like this. So they can move like this. Okay, movement in that fashion they can move. These manipulators provide coarse and fine movements. Next is micro injector. Injector means it is a syringe which is attached to the Teflon tubing, and a steel holder is present. Tubing is there and a steel holder is there. Steel holder is used to hold the microtool injection needle and egg holder. Micro injectors are available as air micro injectors and oil micro injectors. Types of manipulators, which I told are manipulators, those two needles are. There are different types like Narishingi, Eppendorf, and research instrument. Okay, these are different types of manipulators. Narishingi, Eppendorf, and research instrument. Okay, so very important expected question is so micro manipulator system parts. Inverted microscope, micro manipulator, and micro injection micro tool. Coming to procedure, how we will do Icsi. First thing is there are steps. First thing, we'll prepare the oocyte. We'll prepare the oocyte. Then we fix the micro tool fixing, which I told two needles are there. One will fix the oocyte, other will be free. Then sperm immobilization. We'll take the sperms and we'll immobilize those sperms. Then oocyte manipulation is done. Then we'll inject the sperm into the cytoplasm. Okay. So So how to prepare the oocytes? Oocytes cumulus complex which we already retrieved. Now these are incubated. We kept in incubation once we retrieved from that ultrasound guided thing. We kept it incubator, right? So it is kept for at least in the culture medium for at least 2 to 4 hours. Meanwhile, the semen sample is prepared. Okay, following in pre-incubation, the cells surrounding the oocytes are removed. This see, oocyte has some different cells surroundingly. Okay, these cells are removed. These cells are removed. That is known as denudation. Okay, this is assess the nuclear maturity of the oocytes. So to denude that, we'll use an enzyme known as hyaluronidase. This helpful to dissociate the cumulus cells. Okay. So hyaluronidase enzyme is exposed on this oocyte cumulus complex, and it should be that exposure should be only for 60 seconds. It should not be more than 1 minute. Okay. After denudation, oocytes are transferred to that Icsi dish. So once we remove all that outer cells or remove the clothes of that oocyte, we'll keep into the dish. Now coming to protocol, how much you should keep hyaluronidase solution? Add 2 to 3 drops, that is 80 international units of 2 to 3 drops of hyaluronidase solution. We'll keep that solution, we'll keep the drops into that dish where the oocyte complex is there, and we'll start the timer. 1 minute, that's it, then we'll remove. Okay. Pasture pipette is used to take the oocyte comp in and out. So pipette is used. We'll keep that, and once the 60 seconds are done, we'll remove by means of this pasture pipette. Okay. Then granular cells are removed. Gently carry out the procedure. This everything you should carry out gently. Then after removing that clothes or that outer cells of that oocyte, now we'll transfer that complex to Hepis buffer medium. What is that? Hepis, HEPAS, Hepis buffered medium. So, mm, using 300 micrometers flexi pets, remaining granular cells are attached and further denuded with 170 and 140 micrometer flexi pet. I don't know what is this. So all denuded cells are assessed for nuclear maturity. We'll see how can we know whether it is nuclear matured or not by visualizing the polar body. Okay, once the meiosis one is completed, once the meiosis one is completed because of ovulation, we can see one polar body. So visualizing the polar body helps that it is a matured oocyte. Okay, only mature oocyte, that is M2 stage is used for Icsi. Coming to micro tool fixing alignment, I showed you that two micro tools. Now I'll tell you that. Okay, bring the course and fine adjustment to neutral. First, you'll keep it neutral, zero position. With the holding pipette, which is larger in diameter, use this as a guide to set the other tool. So one will fix other so that it acts as a guide. Another we can change the position. Fix the injection tool at the right hand side and bring this line with holding pipette. So injection tool will be on the right side and fixing tool will be on the left side. We'll release the air bubbles if any in the holder, and tubing also will remove the air bubbles and refill the tubal with oil. Okay, so that tubes are filled with oil. Slowly, we'll rotate the injection screw clockwise to release some oil into the pipette till it fills half of the pipette. Half of the pipette will be filled with oil. Okay. Then alignment of the micropipette is done through the inverted microscope and bring the micropipette above the lens with coarse adjustment. So this is done somewhere outside the microscope. Then we'll adjust that in under the microscope. Okay. So we will take 4x times and 10x objective lens and bring the pipette in view with coarse adjustment. Okay. So if you remember, in case of sperm visualization, the objective lens we'll use is 20x. Why? Because 10x we can't see the sperms, and 40x the cover slip will break because it will be 40x means it will touch the cover slip. Whereas in case of doing Icsi, we'll use 4x or 10x objective lens. Okay. Next, initially faint shadow of pipette is seen, then rotate the holder. Okay, we can see the shadow of pipette, then we'll rotate so that we can see the needle and focus on the tip of that eyepiece we can see. Repeat the similar procedure for injecting needle. So here the fixing needle also we can see the eyepiece, even in the injecting needle also we can see the eyepiece by rotating. When both needles are aligned, then shift so we are aligning at 4x and 10x. Now we'll shift to 20x. So every procedure, even sperm selection is in 20x, and even Icsi is finally we go for 20x magnification. Okay, aspirate some Hepis medium in holding. Where in holding needle, we'll aspirate some Hepis medium and PVP, that is polyvinyl pyrrolidone, in the injection needle. Okay, holding needle will aspirate herpes and injection needle will take PVP before starting Icsi. Okay, so now holding needle is okay, oocyte is ready. Now we'll go, we'll take a slide where sperms are there. So sperms are rotating, they're mobile in that thing. Okay, in this mobile sperms, now we'll make them immobilized because if the mobile sperms, if we take into the pipette, now they move very fast, so we can't do it. So sperm immobilization will be done before inserting in before doing ICSI. So sperm immobilization is done by slashing method. Slashing means just they'll beat at the mid piece. Okay. So add diluted sperm preparation to PVP drop, then load the oocyte into culture medium drops on prepared ICSI dish. So we'll take an ICSI dish. We'll take this oocyte here and bring the injection pipette into focus. And we'll bring that injection pipette. Focus the tip of injection needle. Sperm should be in the same focus. Select the morphologically good sperms from periphery of PVT droplets. Okay. The sperm is immobilized by slashing, I already told. So avoid slashing at the mid piece. So generally it is done below the mid piece, not on the mid piece. Okay. Adjust the tip above the tail. So adjust the tip above the tail and lower it to make it contact with the tail and bottom of the dish. Strike the tip from left to right. Left to right if you strike, then sperm are then aspirate in the injection needle. Tail will enter first, and then by rotating the injection anti-clockwise, if you rotate anti-clockwise, then easily the sperm enters into the injection needle. Now, oocyte manipulation. Focus the drop oocyte and drop containing oocytes. We already added a drop of PVP, right, in which there is oocyte. So focus the drop containing oocyte under low magnification, so that if high magnification means there will be breakage of needle. So low magnification will see. Focus the ULM of oocyte under 20x, 20 times objective. Bring down the injection pipette. Focus the tip with fine adjustment. So tip and ULM are in same focus. So tip and ULM will be in the same focus. Z axis movement will be simultaneously done. Okay, to roll so that polar body should be at 6 o'clock and 10 o'clock or to 12 o'clock. So polar body will rotate so that polar body it should be at 12 o'clock or 6 o'clock position. Okay. Focus both ulema and inner aperture of tip of holding needle. So holding needle and ulema is focused and gently aspirate the oocyte by anti-clockwise movement. So we'll just adjust to the holding needle. Aggressive and excessive aspiration, then it will deform the oocyte. Okay. So gently you should aspirate so that it will fix to the holding needle. Now, final step is Icsi. Now you held the oocyte with the holding pipette. Okay, with gentle suction is being done. And now this side you have a holding pipette. Okay, holding pipette prevents the slashing of the oocyte and a bit focus bring to the injection close to the zona pellucida with that sperm. Okay, focus both on ulema and tip of the injecting needle. Make sure it is in the middle of the egg. That is exactly at 3 o'clock position. We'll go and inject. When injection needle is positioned, push the sperm towards the tip of injection needle. Stabilize the sperm at the tip of the needle. Slowly advance the injection pipette into the oocyte. Indentation should be seen at where you push now. There will be indentation at the point of penetration. First, initially you will aspirate the ooplasm into the injecting needle. Initially, flow of ooplasm is seen in the pipette. Then slowly a sudden gush of free gush of ooplasm can be seen. Sudden movement of ooplasm inside the injecting needle confirm there is rupture of oolemma. Okay, once you insert that injecting needle, you can see that ooplasm entering into that needle. That means there is rupture of oolemma. Then stop the aspiration. Once there is gush of ooplasm, then gently release the ooplasm mixed with immobilized sperm into the ooplasm. Remove the injection pipette out of the oocyte and you'll elevate the injection pipette. You'll elevate and release the oocyte from the holding pipette also. Repeat the procedure till all the oocytes are injected. Then transfer the injected oocyte into culture dish. We'll transfer it into culture dish. Okay. So after in keeping that into culture dish, embryo will be formed on day 5. So embryo transfer, this is the pipette which is used. Cervix is visualized by means of cuscos. We'll clean with a gauze piece. Then you'll inject. These are different embryo transfer catheters. So if these catheters are given in exam, you should say that is ET catheter. Okay. So how they'll do embryo transfer, we'll see. Okay. So before seeing embryo transfer, let us see Icsi procedure. So it will be clarified. Huh? So Icsi. So Icsi is So if you see, this side needle is injecting needle, injecting pipette, and this is the total oocyte, and there is a polar body which you can see, and this injecting needle being injected at 3 o'clock position. Okay, see the sperm is being injected uh, into the cytoplasm, and you can see on the left side there is a fixed pipette that is known as holding pipette. Okay, this is injecting pipette and this is holding pipette. This holding pipette is present, right? It is present, and it is fixing the oocyte. And if you properly see, once injecting needle is being inserted into the cytoplasm, a gush of ooplasm enters into the needle. If you properly see, you can find out. Okay, there is, see, sperm bent backside. See, gush of ooplasm is there. Then sperm is being injected. This
This
is Icsi.
incredible video shows how we capture a human sperm tail first
Okay, this is also same Icsi, where sperm being
and
injected.
inject it with a single microscopic needle, 1/10 the diameter of a human hair, into a human egg. It fertilizes and creates an embryo that divides. By day 3, it's 6 to 10 cells, and then eventually by day 5 is a blastocyst with hundreds of cells and hopefully a baby.
Okay, so these are different Icsi procedures. Now we learn about embryo transfer. So embryo transfer is important and crucial parameter in ART. So ET technique may be directly influence the outcome of ART. If you don't do ET, then failed ART. Okay. So poor ET technique may account for almost 30% of failures. So is the procedure of embryo transfer? Patient is put in the lithotomy position. Then cervix will see by means of cusp. Cervix and vaginal vault are cleaned by cervical cleaned for removing the cervical mucus and any vaginal secretion by means of sterile gauge. Then catheter is chosen, suitable one. Before inserting embryos, now we'll do a trail on that patient without any embryos. So, which type of catheter is being suitable, we'll choose that. Then that catheter is flushed with 3 ml of culture medium. Then it is filled with transfer medium. First, it is flushed with culture medium. Then we'll use transfer medium. About 15 microliters of transfer medium is aspirated first. Then next 10 ml of 10 mic, then embryos are aspirated. Then again, see, in that catheter, you will take 15 ml first, then embryos, then again 10 microliters of medium. Okay, that's it. Why we are taking 15 again embryos again 10 means if you take 10, then the embryos will be in the middle of the catheter, not on the tip. Okay. So the loaded ET catheter is introduced into the cervix and it passes through the internal os and gently advances the middle uterine cavity. So it should be stopped at least 1 to 2 centimeters from the fundus. Okay. Then the screw of that vaginal speculum is loosened. Once we lose that screw, now the two valves, they gently press the posterior vaginalis. That means they gently press that cervico-vaginal junction. So patient will feel some suprapubic heaviness and discomfort at this moment. So you will wait for 1 to 2 minutes. After that, once the pain disappears, you will eject that embryos into the plunger. Okay. Once ejected, slowly you will withdraw the catheter out. Speculum is kept in place for average of 7 minutes. How much? 7 minutes you will keep the speculum after that and then remove. Catheter is checked for any embryos. Again, after removing that, we'll check in the what you can say in the this thing microscope whether there is any embryos. If there is any embryos, then again you will retransfer. Okay. If you see this this thing, this image, after transfer, they're checking whether any embryos are there or not. If you properly see what is this central well dish, right? Central well dish. Okay. For difficult cases, we can use general anesthesia, propofol, and it is maintained by isoflurosane. Oxygen 100% you should give. Trail it is repeated if not successful. A tenaculum is used to stabilize the cervix. If it is not successful, you use tenaculum. So, what is the factors determining the success? Uh, so quality of embryos, age of woman, sperm quality, infertility cause like any uterine anomalies, then it will be difficult. Some not so obvious causes are technical background of doctors, embryologists, nurses, setup and quality control of laboratory. These are not that success determining factors. Embryo transfer is an unimportant variable. Clinicians are reluctant to change habits. Much of inefficiency or implantation may reside with embryo transfer techniques. like uterine contractions can occur, and it results in expulsion of embryos. Okay. Mm, Others, like if there is blood and mucus in the catheter, bacterial contamination, retain embryos into the catheter, these easy transfer, smooth transfer without force, difficult transfer where we needed uterine manipulation. Okay, rarely dilatation may require. Difficult transfers negatively associated with ongoing pregnancy rate. Like if it is difficult, transfer only difficult now, the pregnancy rate is almost 10% down. Okay, the importance of keeping embryo temperature close to 37, oxygen and carbon dioxide concentration, these should not be overlooked. It may be difficult to control environmental factors. Thus, the time elapsed between embryo loading and embryo deposition could be a prognostic factor for implantation. So, embryo loading and embryo deposition should be done in no time. Okay. And if you say this, see these embryos, this is a 2 cell stage, this is 4 cell, and this is 8 cell stage. Okay. So now I'll tell you an example. Before entering into that example, let's see some embryo transfer videos as well.
Sir, this waterproofing best.
This one.
Expertly performed embryo transfer using
See, embryo
ultrasound
transfer.
guidance is a critical part of the IVF process. Here we see the catheter tip coming up into the uterine cavity from the cervix. We advance the catheter tip just past the middle of the cavity, then pull back slightly and press the plunge.
If you see, it is almost 1 to 2 centimeter below the fundus. You should not touch fundus, okay? Then you will push the plunger so that embryos enter into the cavity.
We see a flash of media containing the embryos coming from the tip. Then we slowly withdraw the catheter and it's done. That should do the trick.
In this video, they properly actually explained what are the embryos and all. Very properly. Just see this video. So if you notice this is a central well dish. Okay, this is a warming media being used for embryos. So that catheter is transfer pipette. This is helpful to transfer the embryos into culture media. Okay, in which the blastocyst grows. Okay. So after growing and warming with good temperature, the inner cell mass is being formed, and 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 we can see motion detected in the blastocyst. Then outer trophectoderm is being formed. Still warmed, but after a few hours, we can see the inner cell mass and outer trophectoderm. So this total embryo being formed is ready for transfer. So it is loaded in 18 catheter. That is embryo transfer catheter, which has been shown. Okay. If you see, it's already filled with 15 microliters of media. Okay. Now we are taking embryo, and again we'll fill again with 10 microliters of again media. This is not the blastocyst. It is in the middle of catheter, right? Middle of the catheter. Okay. Not on the catheter lip, it is in the middle. Now this is the catheter. If image comes in exam, this is embryo transfer catheter which been shown. Okay, this is embryo. This is embryo transfer catheter. Okay, that white one. Okay, thanks to this channel, uh, for indoor infertility clinic, I'm using their video for study purpose. Okay, now let's learn into a report which showing report came embryo transfer done on day 5. They sent a report that this is the grading, total 1 2 3 4 5 6 7 embryos are being formed, 7 blastocysts are formed, and the grading is 4AB, 3AB, 4AB, 3AB, 3AB, 3BB, 2BB. What is this? How to know? Okay, so and 3 straws are freezed. Okay, so first thing, see, first day is early blastocyst form, then blastocele is seen covering half, and blastocyst fills the entire cavity. That is 3. So if you give one score, that means early blastocyst. 2 means blastocele is forming. 3 means blastocele completely expanded. I mean fills the whole blastocyst. An expanded blastocyst with a zona and thin zona. Okay, inner cell mass. That is 4. Okay, this is a perfectly formed blastocyst, right? In that way. Uh, that's about 1, 2, 3. So 4, 3 numbers I'm telling you. 1 is early blastocyst. 2 means blastocyst half. 3 means blastocyst fills the blastocyst. 4 is expanded blastocyst with that thin zona and all. Okay. Now coming to ABC. What is A? A means the inner cell mass. The inner cell mass, it is numerous and tight. Okay. Whereas B means it is loosely packed. C means few cells. Even trophectoderm also, A means many cells are formed in with tightly one, and B means loose epithelium, and C means few cells. Okay, so coming to grading, if you see about grading, so this is the one. Okay, so if you see the about grading, which I told in our report, it is 4AB, 2 or 4AB. So 4AB, the things which are coming into the blue line, that is 5AA, 5AB, 4AA, 4AB. These are good, best embryos. These are best embryos. Okay. Even 3AB is good. 3AB is good. Okay, in that way. These red things are there. Na? C. C means I told now few cells are present. So C and loosely packed BC, these are all poor, and we need to discard. If C comes means we need to discard that embryos. Okay, that's it about embryos and selection. I hope this video helps you in future. Thank you so much.